Hi, welcome to another episode of our future midwife. From the last section onwards, we are in the track of newborn conditions. Today's class also the continuation of newborn condition. Today I am going to take the minor disorders of newborn. Neonatal conditions are frequently found ranging from minor physical or physiological conditions which can lead to life-threatening conditions. Either minor or major ailments should be reported immediately, need a thorough assessment. Early diagnosis and management of minor ailments can prevent lifelong disability of newborn. Nurses are those who are spending more time with the newborn in each shift than pediatrician. So if there is any variation from the normal should be reported immediately to the pediatrician, which will help to prevent the newborn morbidity and mortality. First we'll see about the diaper dermatitis. It is an acute inflammatory condition of the skin due to the continuous usage of diaper. Usually the fecal matters and urine will be contact with the baby's skin for a long time. So because of that, child develops some kind of itching and red rashes over the perineal area. The main management include we have to change the diaper frequently. So once the baby pass any fecal matter, it should be cleaned properly. For cleaning, we can use warm water or antiseptic wipes. After cleaning it, dry it thoroughly. Then should be exposed to the air for some time. After that, we can use the diaper again. If the condition is persisting for a long time, we have to apply some coconut oil, and if it is necessary, we can use the antifungal cream also. Next, we'll see about neonatal jaundice. It appears on the second day of birth, reaches peak on the 4th or 5th day and disappears by 8 to 10 days. It is a yellow color of skin usually appear on the face, chest, abdomen and leg due to the excess bilirubin in the blood. The management include exposing the baby to sunlight for about 10 to 20 minutes. While exposing the baby to sunlight, baby's eyes and perineal area should be covered. Usually correct itself in a few days. If not, then the baby should be keep on phototherapy. Next minor ailment is vomiting. Vomiting is a forcible ejection of the gastric content. Most common cause of vomiting in 1 month old child will be aerophagy. There are several causes of vomiting like gastric irritation, reflex vomiting, emotional disturbances due to faulty techniques of feeding. The management include the proper advice regarding feeding and burping must be imparted to all mothers. Proper technique of breastfeeding in proper position. Avoid bottle feeding. Fluid and electrolyte balance should be maintained by monitoring the intake and output. Antiemetics medication should be administered as prescribed. Next we'll see about failure to pass meconium and urine. All healthy baby must pass meconium within 24 hours of age. Initially 2 to 3 days, the meconium will be look like black tarry stool. Next 1 to 2 days, it look like greenish stool. After 5 days, it become golden yellow stool. That we called it as a mature stool. The main causes are hypothyroidism, intestinal obstruction, Hirschsprung's disease, meconium ileus imperforate anus, etc. The managements are infants who breastfeed are rarely constipated. Glycerin suppository or rectal stimulation with a lubricated rectal thermometer can be used occasionally. Next we'll see about the stuffy nose. It will be due to the presence of any secretions in the nose which will congest the nose. This can be lead to mouth breathing and excessive air swallowing. The main treatment include clean the nostrils with a cotton wool which is soaked with normal saline. Nasal drops can be clear the congestions. If it is necessary, we can use nasal suction. Next minor ailments is ophthalmic neonatal. Any purulent discharge from the eyes of an infant within 21 days of birth. The baby's eyes are contaminated during passage through the birth canal from a mother infected with either Neisseria gonorrhoeae or chlamydia. The management include the infected eyes are cleaned with sterile swabs moistened with normal saline. Chloramphenicol is commonly used, but erythromycin or gentamicin 0.5% ointments or 1% silver nitrate solution should be used for chlamydial infections. Next we'll see about diarrhea. Baby develop increased frequency of stool if the mother is taking ampicillin, tetracycline or certain laxatives. Intake of large quantity of glucose water and honey by the mother also can lead to diarrhea of newborn. The management include avoid bottle feeding and maintain proper hygiene while using the bottle feed. Wash nipple area in each feed. Put on exclusive breastfeeding. Mothers who are breastfeeding might need to adjust their own diet to avoid any food that could trigger diarrhea in their babies. Keep the diaper changing area clean in order to prevent the discomfort. Next minor ailments is engorged breast. Usually the neonatal breast tissue get engorged due to the presence of high maternal hormones such as estrogen and progesterone. Usually there is no treatment is required for that. It will subside by itself within 2 weeks. Next neonatal ailment is caput succedaneum. This caput succedaneum is a condition which lead to the swelling of the baby's scalp. This caput succedaneum can be occurs in case of prolonged labor. In case of prolonged labor, the presenting part such as head will be stuck in the pelvic canal for a long time, which can lead to the excessive swelling of the fetal scalp. It doesn't need any kind of treatment. It will subside by itself within 36 hours. In some conditions, mother can massage the scalp with the oil. It may subside by itself. Here we can see the next condition, that is oral or perineal thrush. It is a fungal infection caused by Candida albicans. It is characterized by white patches in the mouth and tongue. Perineal thrush may cause soreness of the buttocks and is secondary to oral infection. The skin is extremely red and affected area may extend as far as the umbilicus. The main management include topical application of nystatin or amphotericin cream. Miconazole suspension is swallowed inside the infant mouth 3 times a day for 4 to 5 days. Oral application of 0.5% solution of gentian violet after each feed. After each feed, clean the baby's mouth and mother's nipple. Next we'll see about abdominal distension. Baby with periodic distension should caused by complication of severe gastroenteritis, constipation with ineffective peristalsis and intestinal obstruction. Signs and symptoms include vomiting, increased respiration and refusal of feed. The managements are a flatus tube may be inserted to remove excessive gas if present. Dehydration should be treated. In case of obstruction, nasogastric tube aspiration and continuous drainage may help to decompress the stomach. Neonatal constipation is a rare condition. It can be occurs due to the insufficient intake of milk or water. Usually it is seen in bottle-fed children. The main management include keep the baby for an exclusive breastfeeding. So if there is a proper breastfeeding, it can be prevented. And apply some oils on the genital area in order to lubricate the genital area, which can also relieve the constipation. We can see the tongue tie in some infants. It is found as a thin broad membrane or thick fibrous frenulum with a notch in the tip of the tongue. It can be corrected by frenulotomy as a surgical procedure. Usually it performed after 3 months. The another condition is neonatal mastitis. The enlargement of the breast occurs in full-term babies of both sexes on 3rd or 4th day and may last for a few days or even weeks. Lack of inactivation of progesterone and estrogen after birth due to immaturity of neonatal liver lead to further rise in their levels, thus result in hypertrophy of breast. The main management include, if the abscess forms, we can go for the incision and drainage. Next we'll give antibiotic therapy. Antibiotic therapy can be given with the help of clindamycin and vancomycin, or we can start oxacillin for divided doses. Antiseptic compresses, local massage should be given and mother should be reassured properly. Next we'll see the Naso Faringitis. It is an acute infection of the respiratory tract which is usually caused by airborne organism transmitted by parents, visitors or staff to the baby. Symptoms are running nose, excessive cry, coughing and sneezing. The management include mother and baby should be nursed in a single room and the baby should be given extra fluid. Nostrils cleaned by cotton wool soaked with a normal saline and nasal spray or drops can be used. We can observe excessive cry in some neonate. The main causes are hungry or discomfort, wet napkin, inability to pass the stool and urine. In some case, it can be due to insect bite. The main treatment include, we have to change the napkin frequently and dry the area. Feed the baby properly with a regular interval. Cover the baby properly, it can prevent from insect bite. Next is the umbilical granuloma. It is the condition in which there is a presence of flesh-like pale nodules in the base of the umbilicus with a discharge. It can be treated with the cauterization of silver nitrate and also we can apply common salt. Then we can go for antibiotic therapy. In some infants, we can see the excessive secretions from the eyes. This can be due to the congenital obstruction of the nasolacrimal duct. We can do massage in the lacrimal sac area, that is between the nose and eyes, inward and upward for a 10 to 15 times per day. It will correct it by itself by 4 months. Next condition is cephal hematoma. It is the collection of blood in between the periosteum and flat bone of the skull. It is incompressible, cystic, circumscribed swelling limited by suture line. It is not present at the time of birth. It tends to grow larger. It does not need any treatment. Administer vitamin K 1 to 2 mg IM. In case of infected hematoma, incision and drainage can be done. Administer antibiotic and monitor hematocrit values. The last condition is peeling of skin. It is found in postpartum babies. Dry scaly skin can be seen after 2 to 3 days of birth. The treatment include apply olive oil or cream, etc. Next we'll see the role of nurse. Screen out high risk and babies and use of elective LSCS in case of contracted pelvis. If normal delivery, the nurses should check the following. Continuous fetal monitoring to know the fetal distress. Episiotomy should be done carefully to prevent injury to the scalp. Administer vitamin K 1 mg for prevent hemorrhage. In this class, I explained few minor disorders of newborn. I think we can wind up our today's section. If you like my videos, please support and subscribe my videos. In the next class, we will meet with another episode of newborn condition. Till that, take care. Bye bye.